Hello, welcome to Salina Regional's Morning Medical. I'm Mike Maddock from the Marketing Department at Salina Regional Health Center. This morning we're going to be talking emergency medicine. With me I have Dr. Keir Swisher, an emergency room physician at Salina Regional, and Janine Forsberg is the Director of Emergency Services. Thanks for being on the show.
Thanks for having us.
I think probably the best thing to talk about emergency is how the heck can people stay out in the emergency room and not see you for some of the traumas? Let's start there.
I think one important aspect of staying away from people like me is risk avoidance. Seatbelts is something I really preach and talk to people about as far as wearing your seatbelts, whether it's just going down the street to get groceries or whether a long trip. We see a lot of motor vehicle accidents and people that aren't wearing their seatbelts, whether it's young or old, and the best way to stay safe is by staying in your car. Being ejected from your car, there's a high chance you're either going to die or have severe injuries, and so seatbelts truly save lives. There are great airbag systems out today, but they absolutely don't prevent as much injury as wearing your seatbelt will. Same thing with wearing a helmet if you're riding a motorcycle or an ATV. I've seen 2 people in my 5 years here that have cracked their helmets riding a motorcycle and being hit by a car, both of which walked out of our emergency room holding their cracked helmet in their hands. Had they not been wearing a helmet, they probably would not have survived. And so ways to stay away from people like me is absolutely keep safety in mind, be a defensive driver, avoid texting while driving, and absolutely wear your seatbelts at all times.
Okay. I know another thing is compliance with what doctors tell them. What's some of the things that the emergency room is doing to help that out?
The nurses do a wonderful job as far as like educating the patient from the moment they get in about ways to prevent injuries. And so if we have a patient that comes in from a motor vehicle accident and they've been thrown out of their car because they haven't been wearing their seatbelts, we'll start very, passionately and compassionately educating the patient about how important it is to make sure that you wear your seatbelt. And even, just a couple blocks from home, it's very important because that's where a lot of injuries happen because people feel like they're so familiar with the area. A lot of fatalities happens very close to their homes.
I would say that the emergency department is what I call controlled chaos, and so I echo Janine's sentiments that a lot of things that come in through our ambulance base, people out front don't see, and our goal is to get you safely through our system, and either home to your loved ones or put you in the hospital. And so making sure that you follow our instructions, and if you don't understand what we've given you as discharge instructions, make sure and ask, and then also make sure you get your medications filled, because that's so important. We get calls a couple days later that, hey, we haven't got this filled yet, what should we do? And it's really important if we give you medication that you take it as prescribed.
Thank you very much. Thanks for being there when we need you guys, and thank you for watching. For more information, please visit us at srhc.com and like us on Facebook for the latest news and updates.